Welcome to the Brattleboro Selectboard meeting of Monday, March 10th. It is an unusual and special meeting where we are meeting with our state legislative delegation, and that is the only thing on our agenda other than things like convening the regular meeting. John, was this meeting properly warned?
Yes, Daniel, it was.
Wonderful. And then chair's remarks. I have no remarks. Manager's comments.
No comments.
No comments. Select board comments and committee reports. Do we have any? Seeing none, we're moving along. Public participation. This is the part of the meeting where you could speak about something that's not on tonight's agenda. It's a pretty big list of topics on here. If you could just raise your hand to be recognized, then have up to 3 minutes and keep it civil. Jane Wheeler.
Hi, Jane Wheeler, District 8. And actually, although there's a lot they're going to talk about, I just wanted to bring part of a couple of things to mind, see if they would mention something about it, Daniel. And I went to the advisory board for senior solutions. Been going. I haven't given a report for a while, but that's okay. But I do want to point out that the Vermont Association of the Area Agency on Aging has asked the legislators for an additional $2 million in state funding for home-delivered meals for older Vermonters, and to be able to serve more caregivers of loved ones with dementia and related disorders. They're asking to increase the dementia respite grant funding by $750,000. So I'm hoping that maybe someone can mention something about that or when they might come up. And the other thing that's up in this, I know there's a lot going on in the federal level, but you know, the Older Americans Act, which funds about half of Senior Solutions' budget, is up for reconciliation or I just forgot the word that happens. But they need to reenact that. Yeah, they need to reenact that. And I'm not sure when that's coming up, and I know that Bernie Sanders is helping to pass that. And that's the funding that, reauthorization to continue serving people who depend on it for home-delivered meals, senior center programs, caregiver support, job skills training, and benefits enrollment assistance. So folks could kind of pay attention to that, and they might even just call up for support. Thank you.
Thanks, Jane. Anyone else like to speak about something that's not on tonight's agenda? Okay, moving along. So our only item of business tonight is a meeting with our local legislative delegations. So we have House members, Representative Ian Goodnow of District 9, right? I should have done it in district order then. Representative Emily Kornheiser of District 7, and Senators Wendy Harrison and Nada Hashim, representing Windham County. So thank you for joining us. The Brattleboro Select Board, during the course of this year, had a sort of legislative priority setting process, and the board agreed upon 5 priorities: drug addiction resources, mental health reform, violence prevention, affordable and middle-income housing, and municipal revenue enhancement. And we're here tonight to kind of hear about the work that's been happening in the session, for the board to share their thoughts on those priorities and learn more about what's been happening in those areas, and for the delegation to share about what's been going on and how people can engage. And we're going to try and keep it sort of on point, and also there's a lot to talk about. So we'll go through sort of area by area, and then we'll provide space for comment at the end of each one of those sections so that we can keep it germane. And so we're going to try our best. And I think Emily would like to do a little bit of sort of contextualizing from the legislative end.
Thank you. I'm really glad to be here with all of you. And Representative Molly Burke is disappointed to not be able to make it today. She had a long-standing commitment tonight. I just want to start by explaining where we are in the legislative session, which I think might be helpful, and then talking just for a brief moment about the federal landscape that's shaping our legislative work this year, because I think that might also be helpful context. So we do these meetings twice a year, and really think of the first meeting that is in the fall as the agenda setting period, where you share with us and we discuss what the community, what the town needs, what town government needs, and what we can do about that in the legislature. And right now we're at the midpoint in the session. When we go back tomorrow morning, or some of us are going back tonight up to Montpelier, this coming week and the week following is something called crossover. And that's the week where any bills that are going to be able to pass this year leave the House to go to the Senate, or leave the Senate to go to the House. And so if a bill doesn't pass in this next 2 weeks, and really this next week, it is not available for passage this year. And so that means that this week, we might have the opportunity to tweak final details if we're in the right place at the right time. But it's not a time for new brilliant thoughts of any kind from any of us. And so that's sort of so we're here today to really talk about sort of what updates on what is possible this year and what we've been able to get done, and sort of what we see as sort of next steps down the timeline. I also just want to be very clear that this legislative session is shaped by two big forces. One is that the composition of the legislature has changed a lot. We have fewer Democrats, though the Democrats do still have the majority. And the folks who were elected this year, it was a lot of new people, and so there's a pretty steep learning curve. And there were a lot of people who were elected who actually didn't expect to be elected, and that sort of creates a steeper learning curve. And folks are definitely feeling like a deep need to sort of stabilize and keep things steady, more than bold, brave, big new ideas. And we're doing that all in the context of the Trump administration, the Republican Trump administration, and what that might mean for Vermont. As I said in our legislative coffee hour last Saturday, Vermont has a sort of long-standing history and attachment to ideas around secession, right? And I think that's sort of charming in a spiritual way. Financially, we would be much, much worse off from it. Vermont gets much more money from the federal government than we send in taxes to the federal government. And what that means very practically is that Vermont right now is at real significant fiscal risk. There's a significant chance that Medicaid funding is going to change in extraordinary ways. And Medicaid funding is braided through all of state government, not just sort of the health care that most of our children get, though most of our children in Vermont are on Medicaid. And so what that means is we might be in a situation sometime in the next few months even, where we are rewriting the entire state budget with 50% less money than we have right now. And we are preparing for that moment. And some of that is getting rid of special funds so money can move more easily. And some of that is really getting clear on our priorities and what sort of the power of government can be and can't be in these times. We're also doing a lot of legislative work to protect people's basic rights and human rights, and that's sort of a conversation for another day and something that Senator Hashim is working on more than me. But the fiscal landscape of the work that we're doing in this context, I think, is really important to remember as we sort of dive into next steps. And I'm sorry that was a really big bummer to open with.
It's the context that we're in.
Yes.
Yeah. Thanks, Emily. And so I'm going to rely on my fellow board members to say otherwise, but I think the way that we envisaged this was we would sort of go through each topic, and so maybe we would start here. So the first topic is drug addiction resources. The Selectboard has set this as one of their priorities. Some ideas that were kicking around earlier in the year were about a drug court, aka a treatment docket, drug addiction treatment that is of adequate duration, direct startup incentives to develop sober living programs and beds, and accountable and effective ready-to-work programs. And so, Select Board, do you feel like it's appropriate at this point to just turn it over to our delegation and hear about the work that's been going on in those areas, or did you want to say more on any of those topics right now?
I feel like it's a fine place to jump off. We have a list, let's follow it.
Okay. So.
Great, thank you. Yeah, happy to talk about drug court. This has been something I've been working on for a very long time, and I'm kind of it was kind of disheartening to see how many years it took to get this up and running. But I was speaking with the Chief Superior Judge earlier. He says that the drug docket that is centered in Windsor County is now available and operational for defendants in Windham County. The issue right now, the bad news, is transportation issues, because the actual court hearings have to happen in Windsor, and generally the folks who are going through this process may not have reliable means of getting up to Windsor frequently. So that's the lingering concern that I have. I know that Judge Griffin, the judge who is running the drug docket, has met with the Windsor State's Attorney's Office and the defenders to put on training for how to create the sentence structures for individuals who are going through the drug docket. I'm assuming that that will be happening for Windham as well. I haven't spoken to Steve Brown about that specifically yet, but I imagine that would happen. And, for folks listening, drug court is... I think that sometimes when people hear about drug court, they think it's like a get-out-of-jail-free card, and it's certainly not that. It is something that provides, in my opinion, substantially more supervision and accountability for people who are going through the process, as opposed to the criminal docket, where you get your citation and you show up to court weeks later, and then you have a status conference months later, and there's really nothing in between. And so individuals who are charged with crimes, with drug offenses, and there's no element of violence, they can go through this 14-month process where they have to go through mandatory treatment. They're subject to random drug testing. There's ongoing appearances before the judge. There are case management meetings, job training, if applicable, attendance at recovery support groups. And upon successful completion, then those charges may be dropped or amended to a lesser offense. And so that is drug court in a nutshell. And I'm glad that it's becoming available to Windham County defendants. Still concerned about the transportation and logistics issue, but that's the good news about that.
Did you want to add something?
Oh, I just want to say that's big. That's really big for Windham County to have the drug court. And I want to commend Nodder on that work, because that's something that we've been talking about for years. And the transportation issue aside, which I think is more of a speed bump than anything, this could have pretty significant impacts on the docket in Windham County, which, not everything that Nodder said, I totally agree with. On top of all of that, individuals who would be going through the criminal justice system outside of the drug court but could be eligible for the drug court are part of the reason why there's a backlog, right? Because these people who have these issues are those repeat offenders who are violating conditions of release and coming back again and again. And so having them have an alternative route that they're more supported could really help with the backlog, and that's huge.
Yeah.
And that was funded through a federal grant, which is also really exciting. So the three other items under drug addiction.
I think Liz had
Can
a
we just
question.
talk about that first?
Yeah.
So George Karabakakis was here on Thursday, and I asked him, was he ready and able to support the drug court? And he said he was, and so that was a question that came up. And also, it's just, what can we do? Is there some sort of wraparound service that we can provide to people to get them up to Windsor County?
I think the mover, I don't know what the transportation, that might be a Wendy question, but.
Yeah, the mover, I don't think they do that. Or I'm pretty sure they don't. There are medical rides, but it's a certain trip per month, and I don't think it would work. But there's also an issue in the corrections facilities with the remote hearings, and so we're looking at transportation by some entity, obviously it has to be someone able to transport folks who are incarcerated, who would not be the folks you're talking about necessarily, but we do need transportation between the facilities and the courts. So if we work together, we could possibly make that happen.
So the door has closed that this judge will not avail himself to Windham County.
The door hasn't closed. I didn't want to do anything that would jettison drug court just because of the transportation issue, but I have been working with our legislative council to see can we mandate that the judge be present here in Windham County? We have a court here where hearings can happen. And so that is a work in progress. I don't have an answer yet as to what we can do because, there are the branches of government and there are certain times that we can't quite overstep. So,
Tell him we'll make him lunch.
I'll let them know. I'll let them know about the snacks.
Yeah.
Thank you.
Richard did you have a thought?
Well, I just was curious why the judge couldn't move around. I mean, they did that back in the old Wild West, didn't they?
Yeah.
I'm also curious why he can't move around. So.
Yeah.
I mean, you've had that discussion already?
Yes.
What kind of response do you get when you bring that up?
I get somewhat of a vague response. I would describe it as a vague response. And I would also say there have been other logistical issues that they are leaning on. And when I say they, I'm referring to the judiciary in terms of drug testing availability. And that the nearest drug testing facility is in White River Junction, but there's also a facility in Keene. So that's the type of response that I get.
Great. Franz? All right.
Thank you, Daniel.
We're rolling.
Yeah.
Hi, legislators. You use a couple of words, it seems almost interchangeably, those being court and docket. And I think I know what a court is, but I'm not 100% sure about a docket. Does that mean a way of doing business or a set of rules or a specific courtroom with a specific person in charge? Or because it keeps coming up, well, the drug docket, and I'm never quite sure what you're talking about.
In this context, the court and docket are interchangeable. Yeah.
And are comprised by a place, a set of rules. How do you know this is the drug docket?
So it would be, you have your program of what the person would be going through. You have your criminal docket, you have your civil docket, your environmental docket, your family docket, and those dockets are comprised of cases of a similar nature. So anybody who's going through this 14-month process of mandatory treatment, mandatory drug testing, job training, those cases are on the drug docket, which take place in a courtroom as well. So I am using the words interchangeably. Sorry if that.
And it sits in Windham Criminal, or no, Windsor Criminal, right? Yeah. So it's in the Windsor Criminal Courthouse. So there's other court happening in that building, but the drug docket is one of the dockets that exists within that building.
And a docket usually has a judge who has specialty in that area of law. Not always, but usually. So usually the environmental docket has a judge with experience in environmental law. The family docket has a judge with an experience in family law. Usually, not always.
Okay. Cool.
Thank you.
I'm going to say we sort of said we'd try and do 30 minutes per area, and we're on sub-item 1A. So if we can move on to drug addiction treatment, maybe?
I'm going to do B, C, and D all at once.
All right.
Okay. Thanks to you all and flagging this drug addiction treatment adequate duration question. Had conversations with the Agency of Human Services around eligibility, mostly to find out how much more it would cost to extend the duration, and learned that there was some miscommunication in the matrix of government that caused providers to not seem to understand that doctors actually, or prescribers, have the ability to extend treatment if they think it's appropriate, and Medicaid will cover it when that happens. Also, in the course of those conversations, learned that the main provider for this area is struggling a bit more than we would like, and so not able to expand in the way that we would like. And significant state resources are going right now to just stabilize those services. And so once those services are restabilized, we can look at expansion again. And that is, I think, sort of a continued theme that we're seeing sort of all over the state around a lot of human services providers. And then on direct startup incentives to develop sober living programs and beds, there are actually significant direct startup incentives that we appropriated last year and the year before and likely will again this year. And Turning Point is fully aware of them, and we're in regular communication with them about what it would look like. And there's a network of Turning Points type organizations that have a lot of expertise in doing that, and our Turning Point is more connected to that network now than they were previously. And the last one, accountable and effective ready-to-work programs. There are at least a dozen workforce participation programs throughout our area run through different social service agencies. There's Department of Labor, there's VABER, HCRS runs a workforce program, Economic Services does, and all of those, I think, are folks who are like deep in the human services weeds are very aware of them, but I don't think the public is generally aware of them, and they historically have not been as well coordinated as they could be. A bill has left the House and is in the Senate ready to be acted on that is charged with essentially like significantly integrating those programs at the regional level. And I'm hoping we'll see some real movement on that this summer and into the fall. And those are those 3 items.
Great, thank you. In the packet that we published for this, there is also a sort of bill tracking spreadsheet. And there were 3 bills on here that were related to drug addiction resources. S36, S77, and H, whatever Americans say, that letter 218. Would anyone be able to speak to any of those bills at this point?
The appropriations in the budget are there. And those are from the Opioid Abate and Special Fund. That is happening for now. And the other one was S36. I cannot speak to that.
Yeah, and that's an act relating to Medicaid coverage of long-term residential treatment for co-occurring substance use disorder and mental health conditions.
It's in health and welfare, I'm sorry. I can check it out and let you know soon.
Okay, that'd be great.
Okay.
Yeah, thank you. Select Board, any comments on any of those bills before we move on? John? No?
Oh, I have a comment.
Liz?
So I was talking to Dr. Levine about this in the opioid settlement committee meetings, and I think it's great, your answer about more drug addiction treatment. It's just a miscommunication. But he was also saying that the primary drug treatment is of either 2 weeks or longer, but it really needs to have wraparound services such as sober living and so forth. So, they have to work together, and that's the focus. So I appreciate what you're saying.
Mm-hmm.
Okay. Delegation or board, anything more to say about drug addiction resources before we ask the public for their comments? Richard?
You could have kind of addressed this already, but so, for example, S36 might, because it depends on Medicaid funding, that bill could have just die completely when we find out how much money we're not going to get.
So one of the hard things I think about the tracker is that, especially this year, because of some of the other legislative dynamics I described, committees are tending to not move the bills on the wall and are instead moving 1 or 2 committee bills that have grabbed a bunch of stuff from other bill numbers and are smushing them all together. which is incredibly annoying for the public who's trying to track anything. I'm very sorry about that. It makes the work a little more efficient and effective once it's actually happening. In order to increase, separate from sort of the federal Medicaid question, in order to increase any Medicaid services, and I think we talked about this when we were here last, we would need more revenue to cover those services. And that's sort of a no-go this year. And expanding Medicaid services, this also does not necessarily feel like the right time for it in the federal landscape, yes. And these are sort of essential needs to keep our communities functioning, so it's hard to balance.
Wendy?
Let me just add something. The sponsor of the bill is the chair of the Senate Health and Welfare Committee, so it has a much better chance of getting through since she's the sponsor.
Mm-hmm. Great. Okay, Franz?
Thank you, Daniel. So about a year ago, I went to a meeting of the Project CARE group that meets at the police department, and there's police officers and corrections officers and people from a wide variety of social service agencies. And I was kind of just there to listen, but what I heard was that every single person in that room agreed that sober living opportunities were the most important thing that's missing around here. So I think it's great to hear that now an organization like Turning Point is aware of some set of options. But I wonder if you could tell us a little more about what those options look like, or what type of actual changes we might see in the community based on what's available now. Just maybe a little more detail about how it looks to somebody who's trying to get that stuff done.
I think one of the harder things about our work as legislators is our jurisdiction sort of, for the most part, stops when things become law. And so we have appropriated money, we have created an enabling environment for more sober living resources, and now, frankly, it's up to the community to get that going. And so we've talked about that here, right, in the context of funding for more emergency housing, or funding, in this case, for sober living. But someone in the community here, an organization of some kind, is going to need to pick up the ball, apply for the grant, and find staff in order to build that out. And many of the community organizations have overarching networks that have a lot of expertise to help them navigate that grant process, and Turning Point does, especially because it's designed as sort of a peer-led organization. Their overarching network is quite strong to help them with those things, but they're going to need to sort of work with their network to write a grant, go through an application process, likely go through some sort of internal town process around whatever building they decide to be working in, and then do set up from there. There would be licensing and regulatory work done, probably with the Department of Health, things like that.
Thank you. Now, how about in terms of the amounts of money available? Is this something that's going to happen in maybe one or two communities in the state? Or is this an amount of money that's really going to fund enough places to make a difference?
I believe it's enough money for these to be happening all over the state.
That sounds good.
But I don't
Thank
have
you.
the line item in front of me, I'm sorry.
Yeah.
Liz?
It's also a focus of the opioid settlement committee hearings. And what I've learned is that it's a very grassroots. I mean, the whole state works on a very grassroots level. And so items come from the community and get funded. And so what Emily was saying about Turning Point is definitely true for sober living, and they can either seek funding from the state or from the opioid settlement committee.
Okay, great. Let's hear from the public. Members of the public with questions about this topic of sort of drug addiction resources. Cassandra.
Hi, I'm Cassandra Holloway. I am a resident of Brattleboro. I'm also the director of Building a Positive Community, which does substance use prevention. I also was on the board of Turning Point up until last year. I was president and had been on the board for like 7 years as other roles as well. So I can speak to some of that. I'm also part of the community substance use response, which includes Turning Point. I'm part of it, AIDS Project, Department of Health, and a few others. And I'm sorry, I can't really go them right now. I know that they had applied AIDS Project, Turning Point, and the CSER is what we call it, the Community Substance Use Response, for transportation to get people to things. So when you're talking about drug court, it's unfortunate that was not considered. It was not put to pitch. So that's just something to be aware of. So it's definitely in thought. It's mostly around treatment, but I think that would definitely be considered. I also just wanted to, one of my questions, I just want to say a couple things because I know I only have a little bit of time. We did create this resource guide. This is something our organization started. We updated it recently. So this is just all the way from prevention to treatment and recovery for Windham County. So that's available. It's nice and pretty now. But I guess the thing I would like to ask is about prevention funding as well, because I know that some of the cannabis funding, it was like 30% was hopefully going to be put towards prevention, and that the projection of like actually the revenue was a lot higher. I'm currently applying for an alcohol grant, prevention grant, and it's so necessary for us to be looking at prevention. I don't have the cannabis data right now because I'm not applying for a cannabis grant. I do know the Lotus Graphics is going to be a cannabis store, which really upsets me because it's so close to the schools. Well, there's already so many alcohol outlets. This town has 80 outlets. That does not include all the event permits that go out. That's extremely high for best practices of alcohol density. And we had 265 calls for alcohol for the police department, and that is there was 334 for heroin, crack, fentanyl, and cocaine combined. So 334 for heroin, crack, fentanyl, and cocaine combined, 265 for alcohol-related calls. We lost 446 people in Vermont in 2021 from alcohol-related deaths. And 40% of our 10th through 12th graders in the Brattleboro district, so our high school is here, feel like their parents would think it was wrong that they drank alcohol. That's down from 54% in 2021. And my other concern is we do not get enough compliance checks. FDA does require for there to be compliance checks, and we've had 3 retailers have 3 violations. The worst that happens is a 15-day suspension. Liquor commissioners do not get trainings. There is not a training through the DLL for liquor commissioners, and the retailers have to pay. That was not the case before. So I'm really concerned about the lack of compliance checks and this attitude around alcohol and the access of it, because this is a substance that's also harming our community. And we fortunately do have people that will be here at this table who can play a role in that. But I just want to know if our funding for prevention is at risk, because we were also talking about this, because that's really, I'm applying for a grant for $60,000 a year. Last year it was 70 grants. Now it's less than 20. For the nation, so I'm hoping I get it. If I don't, I will not have I don't have any funding for alcohol or potentially cannabis unless we get some other funding. And as we know, federally. And I also, one last thing, it's 28% of our BIPOC youth used alcohol in the last 30 days compared to 12 of our white non-Hispanics. And because of the funding, as we know at the federal level, we can't even put words in. We're trying to take all those words out as we apply, which is really, really sad. I really, again, hope that some funding can come through the state so we can actually address some of these higher risk populations that our government is, a national government is not. Thank you.
Thanks, Cassandra. If there's an answer to the question there, that would be great. I just want to kind of say that, try to keep it at 3 minutes.
I'm sorry.
I let you go quite a long while past that, and there's a lot to talk about here, right? And each one of these topics is really meaty. So we're just going to need to kind of balance these things.
I have quick answers to a couple of them. So licenses for new cannabis retail establishments have been frozen. That happened maybe late in the summer, but any applications that were already pending at that point were likely going to go through because there is an acknowledgement that some communities such as ours are really oversaturated both from a viability of the retail establishments perspective and for community health. And then the bulk of the prevention money for cannabis, from the very beginning, there was a broad acknowledgement coming out of the Human Services Committees that the best prevention we could do was actually comprehensive after-school programs, meaningful quality after-school programs all over the state. And so the bulk of the cannabis revenue is going towards after-school programs, and that is in a special fund right now, and that is sort of protected towards that purpose. And I'm happy to talk to the alcohol commissioner about having more checks down here. That'll just take a couple minutes. I can do that after the meeting.
Yeah,
Thank you.
I'm not on this committee anymore, but last year I was on the committee that regulates cannabis and alcohol, and the alcohol folks in particular seemed very committed to getting the checks done. So I can help. Emily. Work on that, and you probably know them. I would, yeah. Okay.
Okay, great. Thanks so much. Any other questions from members of the public about the topic of drug addiction resources as it pertains to state legislation and the town? Christina.
Hi, Christina Cheyenne, District 8. Thank you, guys. I just have two quick follow-up questions about that. First, I just wanted to know, it was mentioned that providers are struggling to just maintain their 14 days of treatment, and I wanted to know how they're struggling, if that was like workforce, bed capacity, both, something else. And then my other question was, what can we, the people of Brattleboro, do to get drug court in Brattleboro?
Thanks.
Thanks.
Do you want to take the first one?
I'll take the first one. Yeah. The organizations are struggling somewhat across the board. Sort of like they're encountering some problems with the folks who are trying to regulate them with their ability to follow guidelines, good, healthy guidelines. And so it's all private providers in Vermont, and so the agencies that work with those programs are working to see if perhaps other providers could take their place who might be able to do a more sustainable quality job.
Yeah, go ahead.
Sorry for all the euphemisms in that sentence. Nutter.
So in regards to the second piece, what can the people of Brattleboro do to get drug court down here? I think one thing you could do is write to our mysterious friends in the judiciary branch who lead the judiciary branch about why it's necessary and important that people who are going through the drug docket are able to attend court in person here in Brattleboro rather than trying to find a ride or trying to find some form of public transportation, if it exists, to get from Brattleboro to Windsor County. And I think, also getting creative with transportation as to, what types of grassroots efforts could exist to get people to and from court. I think that's another potential approach, and I think, those are the first two that come to mind. Thanks. But I'll also just add it is something that I'm working on to get it down here in person.
Ian?
And just keep bugging us about it. Probably be the other thing. So we're the reps and the senator, so it's our job too.
Liz.
Who do we write to? What is this mysterious person? If you tell us who to write to, we will
Judge
write
Zone.
to them.
Judge Zone.
So
Judge.
Chief
Superior Judge.
Judge Zone is the Chief Superior Judge. He's kind of the judge that is in Montpelier who testifies in committee and is kind of like the liaison between the judiciary and the legislative branches of
Would
government.
you spell that for me, please?
Zonay. And
Terry Corsones
is also
would also be the other. She's the chief court administrator. Last name Corsones.
Nice.
Thank you.
Very helpful. Okay. If there's no objections, I'd like to move on to the next topic.
Mm-hmm.
All right, so the next one was mental health reform. And I want to kind of like say that these A, B, C, D, and all of these were sort of ideas. And there was, there was conversation around them back in September or whenever it was that we had that meeting. And so I don't think they're the be-all and end-all, but it's kind of where we began. And so I suppose we'd be hearing updates about what's happening in relation to these, if not specifically these things. So fewer exceptions to receive mental health treatment, designated agency risk assessment and required treatment to respond to criminal conduct, humane facilities to move chronically mentally ill people off the street to safer situations they like, better legal options to get intervention and treatment to mentally ill people initially reluctant to receive it. Thoughts on any and all of those?
So, there's a lot to unpack when it comes to mental health and the intersection with the criminal justice system. As I imagine folks know, a lot of things changed when we lost the state hospital, and there was a burden that was shifted to towns and different regions to handle mental health situations, but there was not quite enough resources also allocated to rise to the level necessary to address all of the issues. When I'm looking at the first piece, fewer exceptions to receive mental health treatment, can I again just get some clarity as to what the discussion is around that, or what is meant by it?
Go ahead.
I can address that. That original sense was that co-occurring mental health issues with drug addiction were not, because a person had a substance use problem, they couldn't get the mental health treatment that they needed. That was what was conveyed to us as a problem in the system right now.
Thank you.
And I think from a process point of view, the next time this meeting happens, which would be like the follow-up, maybe we could have the minutes from the previous meeting included in the back material, because a lot has transpired between here and there. Nada, did you have any other thoughts or questions of Ian?
I think one other thing, and this will come up as well in the violence prevention portion of this meeting, but the legislature put some significant work into pre-charge diversion last biennium, and in this biennium we are making budgetary decisions that prioritize that to make sure that it's funded in every county in the state. And while that's not directly mental health, there is an element there that there are individuals who are probably eligible for pre-charge diversion that aren't getting it currently, where if they were to get that, they would have an opportunity to interface with some of these community programs that could help them earlier on, instead of basically going through the normal docket and violating and basically not getting the services they need until a lot later on. So obviously we don't really know how that's going to impact what we're seeing on the ground, because it hasn't been fully funded yet. It needs to be fully funded this year. And there is that work is happening in Windham County, but this would continue that work and I think expand it some too. But then it would also have it happening in other counties too, which matters because people who are charged with crimes in other counties also come to Windham County. So regional justice and addressing and making sure that we have justice across the state matters for Brattleboro too.
And one other thing, actually two other things I want to add, not specific to any of these points, but mental health in general. In a conversation with prosecutors in this area, and a defender as well, actually, there is a desire to have mental health pretrial supervision, almost more so than pretrial supervision in general for repeat offenders. Not that they don't like the pretrial supervision, but there was an emphasis that mental health pretrial supervision would be just as helpful, if not more helpful, than pretrial supervision in general. So that's one point. And the other piece is how cases get resolved or just not resolved when somebody is found not competent to stand trial. So far from what I've seen over the last year, when somebody is found not competent to stand trial and there are no pending motions, the case just exists. And then the judge says, all right, well, if somebody wants to do something, go for it. But other than that, it's just going to remain in limbo. So I do have a mental health criminal justice bill that I'm working on. It's not something that's going to be ready for this year. But that's going to be one of the pieces that will be addressed in it.
And the piece about, I think we've talked before about how there's a sense that folks are often put under the supervision of the Department of Mental Health, and sort of the local liaison for the Department of Mental Health is our designated mental health agency, that's HCRS, and how there's sort of a disconnect in what that responsibility means. And I know that our House Human Services and Healthcare and Judiciary Committees are all working on that this year, but what the resolution is isn't clear. And are you working on the David Gartenstein?
Yeah.
Both of yours? Okay.
Yeah. And part of that is there's sort of a theme. If I can speak so boldly as a theme in the legislature, I'm so new that I don't know if I can say it quite like that. But at least I'm picking up on a theme of sort of oversight as an element of like what we're doing this year. And in judiciary and human services, part of that has been kind of bringing in all the players who are involved in these different parts of the justice system and sort of hearing how it's actually happening on the ground, which helps to inform new legislation that could hopefully sort of smooth things out or make things work more efficiently. That takes a lot of time, though, getting all of that testimony. It's like weeks and weeks that we've heard from a lot of different players. But it's been very informative, and I definitely see that there's a lot more work to be done in this particular area.
Thank you. Liz?
We've been aware of cases in Brattleboro where people are really begging to have criminal treatment, I guess mental health treatment for criminal cases, and that the state is extremely reluctant to do that. And do you see that reluctance? Do you see any change in that reluctance?
What do you mean by the
legislators?
The court-appointed point person to come to court and say, yes, we will give in-bed treatment to this person who has a mental illness. That person is very reluctant to do that. I think because of less resources at the state level, and they don't want to commit to that.
There have been instances of that that are shocking when I see it, and I don't quite know why. I mean, well, I have an idea. Generally a lack of resources, and also perhaps a fear of liability, maybe. But that's it is a problem. And I want to acknowledge that. So yeah.
Okay.
Well, just maybe in your oversight, that could be an element.
Yes, it has been suggested to me.
Anything else you'd like to communicate to us about work that's going on in this area?
The mental health reform and the violence prevention have similar words in both of them.
Mm-hmm.
Humane facilities to move chronically mentally ill people off the street to safer situations they like. There is work towards more peer respite facilities, even sort of in residential peer respite facilities. There's bills that might or might not move forward related to that. There's there is funding for that, and again, there needs to be community partners willing to do the implementation related to that funding.
Okay, thank you.
I feel like a broken record today, I'm sorry.
That's okay. Board members, anything you want to ask about any of this, Richard?
Just maybe point out the obvious, but everything on this list pretty much is dependent on Medicaid money, mostly the Medicaid population that you're talking about. And it's pretty depressing to think about the proposed cuts that are going to happen and what's going to happen to all these people. So I guess the bottom line for me is, and maybe it's not relevant to this meeting, is what's the bottom line on Medicaid? If we lose the anticipated amount of money, is it even worth talking about any of this?
We are talking about an enormous amount of money, billion-ish, and what is more likely to happen, and none of these decisions have been made yet, isn't that anything funded by Medicaid would disappear. It's that money would be moved from other programs to cover some of those Medicaid services, certainly not all of them, but some of them. And then likely we would be seeing the loss of other programs that we might like.
Yes. Thank you.
Yes.
For that
So
rosy picture.
I just want to understand. So that's entirely a legislative action that would happen through the budgeting process?
So it might happen when we're out of session. We never know. And then there are legislative committees that act, such as the Joint Fiscal Committee and the Emergency Board, are enabled to act to make budgetary changes during the off session. So they might make some of those decisions, and certainly it would be done in deep consultation with the administration. And I'm realizing this might be a useful time for a public service announcement that the treasurer has a meeting on Saturday at, I believe, the middle school.
Yes.
To talk about the work that they're sort of overseeing around response to the federal landscape. And people should register for it in advance.
Okay.
9 to 11. So
9 to.
it's interesting because, these cuts are not a fait accompli. They have to go through the legal process. I got an email today saying NEPA regulations have been canceled. And I talked to somebody at the Corps of Engineers, and he said, we'll deal with it when we know that it's real. So we are all in limbo, waiting for the courts to decide, whether this overreach is legal.
Okay. Further information you all want to provide, or further questions from the board? If not, we'll hear from the public.
About the last one?
Mental health reform is the general topic area. Okay, seeing none. Christina Cheonier.
Hi, Christina Cheonier. I thought there was one more on that list that you were going to mention about
I have it on my phone.
where it's about how to help people get into mental health services when they are reluctant to do so. Did you guys talk about that?
I don't believe so. That particular topic is one that is one of the topics that I think people butt heads on the most in the legislature, because it comes down to the conversation of bodily autonomy and a person's rights, regardless of their mental health status, compared with the safety of that person and the safety of the people around them. And every time that it's brought up, it tends to, I don't want to say that it devolves into a fight, but it gets very heated in the legislature as to what types of changes we can or can't make when it comes to requiring somebody get mental health treatment, whether it's against their will or whether or not whether they have the capacity to understand that they're going to be getting mental health treatment. So it is something that is discussed. Unfortunately, I don't have a solid answer for you as to what a resolution might look like for that.
And when there are issues where people are constantly, where sort of an issue, when it comes up, people just tend to stake their stand. It's much easier for the default is that current law stays because it can't be resolved, right? There's really encourage you all to have Sue Graff and George Karabakakis from HCRS in to sort of talk about access to all of these things, because there's certainly a great big area between easy access to mental health services and mandatory mental health services. And we could certainly make it a lot easier in this community to access ready mental health services than we have right now, which might do a lot to lower the need for mandatory mental health services.
Okay, thank you. Other questions from the public? Frick?
Frick Sprite, District 9 Rep. A situation was brought to my attention recently where someone attempted to break into a friend's house, and this person was confronted and reported and was seen on camera attempting to get into my friend's house. And the police refused to do anything about it because nothing was actually stolen, even though there was an obvious attempt to get into the house uninvited with a bag in hand to gather up whatever they could find. It was extremely obvious. And so I'm wondering what we can do about both the police and the criminal justice system, to the courts, to actually get some action on these things before.
Thanks, Frick.
Yeah, anyway.
I hear your question, and I think it's a reasonable one. We're currently sort of in the topic of mental health reform.
Well, this was a drug addict, so, it comes under the general category of getting people the help they need rather than letting them loose to continue to do, harm, whether it's mental health, whether it's, self-medicated mental health, or whether it's criminal activity. I think it all is of a piece.
Okay.
I think the police department is a municipal issue.
So, no, it's a great opportunity to talk as a new legislator about something that I'm learning, which is to, when you're faced with an issue, to look at, is this a legislative fix or is this an application of law question? And, everything looks like a hammer when you're holding a hammer. And so I see everything... Oh, everything looks like a nail when I'm holding a hammer. Thank you. And so everything looks like a legislative fix now to me, now that I'm sitting in the legislature. And when I was sitting on the select board, everything looked like a municipal fix. And so Frick, to your question, I think I would start my not knowing anything about this specific instance, really. My first question would probably be first to the police department and then to the state's attorney. So to Steve Brown and to Chief Hardy about what the discussion was around that particular issue. Because it sounds like there probably was something that could have been charged, attempting to break in, if there was actual entry, even if something wasn't stolen, that kind of thing. And I'd be curious to know. And if they were running into a statutory issue, like they wanted to charge, but they weren't able to, now we're starting to talk about a potential legislative question.
Yeah.
But without more information, I would start on the community level.
Yeah, thank you. Great. Okay, other questions before we move on? We're doing pretty well. We're trying to do 30 minutes per topic. We're hitting the 20-minute mark right now. Christina?
Well done.
Christina Cheyenne, District 8. So what I wanted to say about the, if it's super sticky to get people into some psychiatric hospital, maybe another place to put some work is into what happens when they actually get out, which I know you guys are also doing. But I mentioned this at a coffee legislature situation that you guys were at, and the about when people are discharged from psychiatric hospitals and what their discharge plan is, and Sue's answer was like, well, it's not a one-to-one, it's really just based on that person's need. And just in my own firsthand experience of a family member being discharged from a psychiatric hospital, it made me wonder, what are the legislative requirements of a discharge plan? Because the discharge plan in my 20-year-old niece's situation was like, color in your coloring book, listen to music when you start feeling upset. Like it wasn't actually like, here is some care. And I looked for a situation like a day program, but just when people are released from the retreat, they are scared and they're scary. And we really need somewhere for them to go, not just a list of phone numbers for them to call or some people that they know in town or a coloring book, like an actual transitional facility or something along those lines that I have not encountered and have looked for in our area. Thanks.
I've also had a loved one released from a mental health facility with very little plan, and it is infuriating and terrifying and scary and sad. And the good legislation does not go that far into the weeds because it makes it really hard for anyone to do their jobs. If there likely are regulations related to discharge planning, but that would be happening more in the rule-making process, which is a relationship between sort of the agencies that oversee programs like that, and possibly also, I know that most of our mental health facilities are subject to an enormous amount of federal regulations as well, and so it's something that certainly would be a great conversation to have with the Department of Mental Health about what their regulatory relationship looks like and where their rules and rulemaking are. And the rulemaking process is somewhat bureaucratic and formidable, but is a public process technically. And so I'm happy to help you connect with it if you'd like.
Thanks. Liz, you had a question?
We've had experience in town of people being discharged, and we've talked to the provider, and they say, well, we always have a discharge plan, but we can't make people abide by them. And it's that whole free will issue again, rearing its ugly head.
It happens.
and
we won't have it in a little bit.
And what happens? They end up on the library doorstep. So it is a problem. I commend Christina for bringing it up, and we've been trying to tackle it at the municipal level, but if there's help at the state level, we'd appreciate that too.
Thanks. Franz?
Yeah, I would add to the discussion that there are standards of care for discharging someone from any medical setting. And if those standards of care are not being adhered to, then the institution opens itself up to liability if there's any bad outcome based on the failure to have an adequate discharge plan. And that would include, backup referrals for ongoing care, what to do if type scenarios. So I haven't seen any discharge plans specifically from the retreat, but I am aware of at least one case where there was a bad outcome after discharge and the institution was held liable for that. So that would go through, well, the court system, hopefully not, but also through the Board of Medical Practice for the state if either individual practitioners or institutions are failing to make adequate discharge plans for their patients.
Thanks, Franz. Richard?
Over the years, I've helped a lot of people with healthcare advocacy, and one of the issues that I've dealt with is inadequate discharge planning. And what I've found is there is a very good mechanism for getting an institution to clean up their act, do a better job, not only for an immediate case, but in the future, is to file a complaint with the licensing organization. whether it be the Joint Commission Accreditation of Hospitals, the national organization, or the state licensing organization. Every time I've done that, I've had amazing results. The fear of losing a license is about as good as it gets in terms of enforcement, as far as I can tell.
All right.
Good idea.
Good information. Any other members of the public who want to speak about mental health reform? If not, we're going to move on to violence prevention. All right, let's move on to violence prevention. So the board came up with some priorities. We said automatic court dates for offenders that violate conditions of release, better pretrial supervision for repeat offenders, reduced discretion for pretrial release of violent offenders, resolve the criminal court backlog, and a mental health calming center in Brattleboro at which violent individuals can avoid further crisis. Legislative delegation, thoughts on any of that and what's been going on in the State House?
First, I just want to say I'm happy now to have Ian do some of the lifting with me on this topic. I just want to start by briefly highlighting some of the changes that were made last year. Last year, there was more conduct that was criminalized, specifically related to drugs, guns, and trespassing. When I spoke to Commissioner Demmel, the Commissioner of the Department of Corrections, I think it was in June. It was warm, so probably June. He had mentioned that the capacity of our prisons in Vermont was around 133%. Recently, if my math was correct the other day, I think we're maybe around 136, 137%. On September 1st of 2023, the total population in our prisons, both sentenced people and detained people, was 1,366. As of January 31st of 2025, it was 1,459. And just to differentiate, detained people refers to individuals who are being incarcerated prior to being convicted of their offenses. So there's also a 14.2% vacancy in the Department of Corrections, which is double what it was in 2019. So that's kind of the framework right now of what last year's legislation has caused and where we're at on that specific topic. But moving forward to a much easier response to subsection A in violence prevention, automatic court dates for offenders that violate conditions of release. That is something that already happens, and that concludes my answer to that. And I'll pass the baton to Ian for the rest of it.
Yeah, Nara takes the easy answer. Also, I didn't actually get to say thank you for having us. For me personally, I haven't actually been before the Brattleboro Select Board since I stepped off the board. So it's pretty weird to be on this side. Super glad that I'm able to be here, though. Violence prevention and talking about criminal justice has been a large part of what I've been working on so far. So I'm just going to kind of list off, to answer the questions that you guys have as the subsections here are pretty broad. So I think there are some specific things, but then just generally talking about the work that's being done that addresses it in some way. So I think first and foremost, just to make sure we're talking all on the same page, Governor put out an omnibus public safety bill. And it covers a lot of things, some fairly targeted, some fairly broad. The way that the legislature, if I understand it, has been handling the omnibus bill has been breaking it into smaller chunks and addressing them separately. So H2 is raise the age. That's a part of the omnibus public safety bill, which is not particularly relevant to our discussion tonight, but that's just an example of one. H409 is the bail revocation bill. That is out of the governor's omnibus public safety bill, and House Judiciary will be hearing testimony on that on Thursday. So that's a big part of subsection B and C. I think bail revocation is what, and what are we actually talking about? It's like, does somebody, when they get charged with a crime, are they able to get bail? If they get bail, when are they able to get bail? And if they violate conditions of release, are they able to get bail again? Like, what's the system there? So it'll be an interesting discussion. I think Nader did a very good job in previous legislative discussions with the Select Board, discussing and sort of explaining the constitutional issues that get very sticky.
I think that's worth re-explaining.
Yeah, I want to do it very briefly, though. So basically, State v. SOV is the case. The SOV factors are what are discussed when someone is setting bail or trying to decide whether bail should be set. And they are you're basically trying to establish a balance between whether someone is a flight risk, and depending on what the charge is, whether there is threat to the community. And that balance and that question is the constitutional issue where that gets thorny and tricky to navigate, which we could probably spend the entire meeting talking about. And Nader, I know, has probably more that he wants to say about that. But that's kind of but that said, we're taking up a bill that's talking about trying to change that law. Whether it's constitutional or whether it moves forward, that's well, I guess we'll see, So that's one thing. Another thing is talking about the backlog. So took a lot of testimony in committee about what's happening in the courts with the remote hearings and with people who are incarcerated, who are getting testimony or who are in hearings remotely, and how difficult that is for everybody involved and how much that is contributing to cases not resolving. So one of the budget priorities that came out of our committee, out of House Judiciary, was additional transports from DOC so that basically we have more capacity to move incarcerated individuals from the prison that they're located in to court, so that they're there physically, so that their lawyer's there physically, so the state's attorney is there physically, and cases actually resolve when that happens. And we heard lots of testimony about why that's important, and we have made a priority in the budget from our perspective to make that happen. And it's ridiculous that it really boils down to, are there enough transport vehicles and individuals driving the transport vehicles to make it happen? And that's really where the rubber meets the road, really. So that's a big one. Another big one that I already touched on was pre-charge diversion. I really think that will help, and I think it already is helping, and funding it is important. And then finally, and this is one that doesn't come up in any of your bullet points, but I think is really important to just speak on very briefly, is prioritizing and funding victim services. So one of the issues with the backlog right now, and we've heard a lot of testimony about it, is that from the moment a crime is committed to ultimate resolution of that charge is years. And that hurts everybody. But one of the people it hurts the most is the victim of the crime. And we have capacity and we have entities within the state of Vermont that address and work with victims very early on, right? Like we're talking days after the crime is committed. And they're underfunded, and the resources, the money that they are funded with are coming from resources that are not sufficient, and they're not from the general fund. And so we took a lot of testimony, and we have made budget priorities to actually fund these services, because they are an important part of addressing the backlog to make sure that the people who are actually victimized by crimes are being taken care of by the state. And so those are like some of the big areas. And I'm sure I missed some stuff, and I'll pass it back to Nader.
Can I jump in before?
Yeah, please.
I just want to remind folks that last biennium, the two top reasons that we raised new revenue for the general fund, one of them was to fully fund the judiciary so we could have enough court officers, enough judges in order to actually move the process of justice along, which is good for absolutely everyone engaged in the system. And that funding just kicked in July, and it takes a while to hire people, but there is momentum there.
Yeah, and I really appreciate that. And That's specifically when it comes to judges. So the judges take a while to train. I saw Judge Treadwell up in Montpelier because he's one of the judges who trains the new judges in criminal law to be a judge in the criminal court. And that they're just going onto the bench in the last month or two. So that's a budgeting priority that was made by the legislature a year ago, 2 years ago, and we're just seeing the impact of that now. So we won't actually see what the impact of the backlog is for a little while. So we'll have to give it some time.
And this money will come to Windham County equally as it does other places, or?
Yes.
Yeah, it should.
Just a clarifying question on something you mentioned, the victim support.
Yeah.
And that there's funding available for somebody who was the victim of a crime. I mean, we just recently, days ago, had a situation downtown, and smashed out windows, small retail shop, register stolen. I mean, that if all of that is returned, we're still looking at $1,500. If none of that is returned, it's like $2,500. How does a guy like that sort of tap into this thing?
So there are funds available for victims to recoup some loss.
Right.
I don't know the specifics about how much they are able to, but it was in like the thousands of dollars is what we heard. There are conditions as to how you get it, but what's important is it's pretty immediate. So it's not like the end of when the charge finally resolves that they can get paid. Right. It happens early on. It's actually one of the reasons why the funding of these things is so tricky and how we need to make sure that we're funding them sufficiently.
I just sent you a link.
I'm sorry?
I just sent you a link.
Great. Good, you.
Thank you.
I did.
All right.
Thank
you.
So, can I add a bit? So the judge positions, so right now, we just talked about the judge positions. Right now, with the 6 new judges that we confirmed, we are at a full bench for judges across the state. I think
for the first time.
Yeah, for the first time in a while. I'm not sure when.
Really long time.
I do think another judge might be retiring in the near future, but I'm also on the Judicial Nominating Board, which is essentially the committee that does the hiring process for judges. We're meeting in May to organize and then also just begin that process. So, we are slowly digging our way out of the backlog. One of the things that has often been emphasized in committee by judges, prosecutors, and defenders is that the most important pieces in the criminal justice system in general, when it comes to trying to prevent crime, really, is one, the likelihood of being apprehended or caught by law enforcement, and two, the timely disposition of a case. Mm-hmm. So if somebody is arrested and they don't resolve their case until 5 years later, which is when they get put on probation, a lot can go wrong in that 5 years. A lot can also go right, but compared to situations where somebody's case is resolved in 6 months, which is lightning speed for courts, that can have much better outcomes. And so that's why, my understanding is the PD is fully staffed up, which is great, but we're still doing what we can to make sure that cases are getting resolved at a faster clip. So that's on the backlog, and I just want to address generally that we hear often, at least in the judiciary committees, we hear the phrase "catch and release." I'm sure everybody in this room has heard that, and I just want to note that when we're talking about this concept of catch and release, what we are talking about is collectively the Fifth, the Sixth, and the Eighth Amendment. There is not some quirky, eccentric Vermont law that is just, let's not send anybody to jail, let's not arrest anybody. So we are, every day working within the guardrails of what is required of us constitutionally, both on the U.S. and the state level for our constitutions. And, there've at least once a year so far I've seen my favorite ledge counsel, Ben, he's come rushing in a number of times to tell us when something is very blatantly unconstitutional and to tell us that, we're going to get sued if we do X, Y, and Z. And 90% of the time, it has to do with a bill that's been introduced related to pretrial detention and sending more people to jail before they have been found guilty. And typically, it is best practice when your attorneys show up to frantically tell you, if you pass this bill, you will get sued and there will be a preliminary injunction. And when you get that advice, generally it is wise to follow that advice. So I just wanted to put that out there.
Thank you.
Thank you. Senator Hashim did bring a hardcover copy of the Constitution to this meeting today.
Very
if anyone
nice.
would like to peruse it later. It was bought locally as well.
Everyone's books.
And really want to sort of, again, highlight that sort of remarkable research that it is about sort of ready and quick justice. It is not actually about the term or the severity of the punishment. I think it's a really counterintuitive thing for sort of Americans to get their heads around. And item E, a mental health calming center in Brattleboro at which violent individuals can avoid further crisis, I'm supposed to speak to. On previous agenda items, I mentioned that there was sort of significant funds available and no one in the community had been able to sort of step up to write an application to receive those funds. I'm aware that a group of folks with expertise actually drafted an application for a mental health calming center in Brattleboro to really address some of these needs.
Cool.
And other community members went to the folks who were presiding over the grants and asked that they not receive them. And that's hard. That's just hard, but that's what I know of progress on the Mental Health Calming Center. I think HCRS is also working on it, but I don't know what progress they have made.
HCRS told us that they were not working on such an item.
Okay, so that's where we are on that. But
Yeah, thank you.
funding is there.
Yeah.
Can I add one last point regarding the backlog? And it may be a good segue into housing as well. But one of the other issues is also we need a lot more lawyers, which is, people don't like hearing that. Because yeah, believe it or not.
Oh my God, and Craig left.
Thank you for your time.
So, it's, with Vermont's demographic, there are generally a lot of people getting older, and that includes a lot of lawyers who are on their way into retirement without any people to pass on their practice to. And a lot of the public offices, prosecutors, and defenders are also, it's very challenging to fill those positions. I was talking with Steve Brown, our state's attorney, a couple weeks back. In the last session, we provided them with one limited service position, which is now being filled by Attorney Anthes. And Steve was saying how years ago, when they would have a position open like that, they would get at a minimum 50 applicants. This time, they got one, and that was George Anthes. And so, part of it, I think it may have to do with housing. It has to do with pay. A new law student can go to New York City and just from the beginning make six figures. But, you're not going to be making that in Vermont until you've been practicing for a while, probably in a private firm. So there's the pay, the housing, and, just figuring out how do we attract attorneys to work in these public offices. So that's just another point I wanted to put out there.
Okay, thank you. Board members?
Segues into housing.
Well, we're not going to segue into housing just yet.
Yeah.
Franz?
Thank you, Daniel. I get it that we have like this Constitution thing that we go by. Or some people do. There's some others who or less committed to it. But I'm just wondering how much leeway is there in the judicial system for the judges to make a decision? You know, is bail's going to be $100,000, bail's going to be $10,000, somebody's going to be held because they seem dangerous, or somebody's going to be released because we're not sure they're dangerous. I mean, clearly there are boundaries on what the judges are allowed to do, but I wonder how does it feel inside the system? In terms, how much wiggle room is there, and are we at one end of that wiggle room or the other right now? How is it working?
So, yeah, I can take it there. So when it comes to bail, bail can only be used exclusively if somebody is a risk of flight, but there are other factors that can be taken into consideration, but those other factors can't be taken exclusively as the reason for imposing bail. So some of those factors include the seriousness of the offense and the number of offenses that the person is charged with. And so that's bail in a nutshell. But you also have pretrial detention, or a situation in which somebody is being held without bail. Those are for violent felony offenses where the weight of the evidence is great and there's no combination of conditions of release that will guarantee safety. And the other is for life offenses. So if you look in the statutes, if you're curious about it, it's in Title 13, 7553 and 7553A. And that basically mirrors what was changed in the early 1980s because prior to the 1980s, the only time somebody could be held in pretrial detention, or held without bail, I should say, was if they were going to be facing the death penalty or life imprisonment. After a significant increase in crime in the 70s, there were some changes made in order to allow people to be held without bail if they had committed a narrow list of extremely serious offenses, is how the Supreme Court described it. So I feel like I'm kind of going off on a tangent, but that's the context and how it's connected to what we've put in statute and in our own Constitution. Our own Constitution, which we amended right around the same time that the federal government was making changes in the U.S. Supreme Court.
I just want to, and to answer the other part of your question, this is an opinion. There is pretty significant discretion from county to county as far as how a judge makes a determination on, less on the hold without, but on the amount of bail, what conditions are imposed, right? There are, as Nader just explained very well, like a lot of guidance as to be used for how a judge makes that determination. But how the judge makes the determination, there is discretion. And I don't know if that was what your question was about, kind of like where we are on the spectrum, but yeah.
That is what my question's about, and I'm asking for an opinion as to, are we at a proper balance point now? Because, the whole catch and release phrase basically is saying we're not at a proper balance point. I mean, I don't think anybody seriously thinks that people are just let go without any thought. But I think there is a question, people in the community in general, of whether we're doing it the right way, or should there be more uniformity among judges? Should there be different guidelines coming from some higher source? Is there something else that should be done about this? I guess that's my question.
I think it's a delightful accident that we have two attorneys as our two of our four legislators. I think it's important to remember that folks who have not had a trial yet are innocent in the eyes of the law and should be in all of our eyes, right? That's like the essential construct of America. It's one of the essential constructs of America. But I would also encourage, we have this delightful annual visit to this courthouse where all the legislators are invited to spend the day at the courthouse, and we get to see the courthouse, we meet with the court officers and the judges, and I think the Selectboard could separately or all together go visit the courthouse and learn about that branch of government. Because
like a
I
nice
think a
plan.
lot of what we're talking about is sort of the execution of justice, not the sort of enabling environment for justice.
Right.
I just want to add, go see, talk to the state attorney also.
Mm-hmm.
That would be a great field trip.
Yeah. I'm trying to like have as loose hold of this as possible. I'm like, sometimes we're right on the money with like legislative things, and sometimes it's a little wider than that, and that's okay, I think.
Mm-hmm.
Let's hear from the public. Violence prevention is the topic.
Do you disagree?
I'm going to go to Zoom. Kelsey Rice. Hi, Kelsey.
Hello, everybody.
Yeah, go right ahead.
Not very loud.
It's a little quiet in here, but that might be on our end. Just yell at us.
I will keep it brief. I'm sure you all can guess what I'm about to speak to. It's so rare to hear a representative throw in victim rights in this conversation. I'm so grateful. Looks like you all can't hear me right now. All right. Sorry. Well, Representative Goodnow, Ian, thank you so much. I could go on and on about the many ways that victims and survivors are let down and lost in this process. And thank you for lifting it up today in the select board meeting. And both Senator Hashim and Ian Goodnow do a fantastic job in their committees. I have a habit of watching those meetings, and you all should tune in sometimes when there are matters that are important to you. Thank you.
Kelsey. Okay. Cassandra?
Hi. So I just wanted to second Kelsey on that. I had my office broken into last year, and it was broken into 13 times by the same individual who also broke into multiple places. And having the victim advocate call me and just like keep me informed of what was going on and giving me the opportunity, which I haven't had yet because this person has refused to go back to the courts to actually get their hearing. But at my point is like it's traumatic to have your office broken into or your business broken into that or your home. So I wanted to just also second that it is actually helps with the trauma of it. So thank you.
Thanks, Cassandra. I think I saw Christina's hand.
Hi, Christina Cheagne, District 8. Since there are some things that the Select Board prioritized that there's funding available for, as long as someone in Brattleboro comes forward and writes a grant for it, I just wanted to hear from the Select Board, specifically Elizabeth McLaughlin, why, when there was a proposal for a mental health calming center in our town, you shut it down so hard. And I want to know for everyone out here in Brattleboro who would like to come forward with proposals, what it was about that, especially since it was on your priority list, that that you felt like it was so important that our town did not have that opportunity, especially since it would have been paid for not by taxpayers.
Thanks. Liz, if you want to speak.
I have a written statement that I could send you. There were statements made by the...
It was the same.
Could you...
You read the written statement at that committee meeting,
Yes.
so we've all heard that written statement.
All right. Well, everything I said...
Okay, so can I
Christina, can
change
you
my...
let Liz speak? You just asked Liz to speak.
Everything I said I meant. There were many statements made at that settlement committee meeting by the applicant that were untrue, and I brought that up to the committee. There were also many people in the community who also contacted me, searched me out to find me, to tell me the problems that they had with that application, and I voiced those elements. One of the things was that it wasn't a recognized entity to receive such funds. There were many, many problems with that, and there was not the collaboration in the community for that project that was offered. That was not the case.
Yeah, I'll speak to it as well, because rather than dance around it, let's name what we're talking about here so people know what is being said. So there was a proposal by a group that became known as like Each Other. It started off as like the, community organizing something. And it was a proposal for a sort of two spaces, I think, a sort of mental health kind of resource and something more intense. And it was a proposal that went through the Opioid Settlement Advisory Committee process. They also sought funds from lots of other places. And what you're referencing is a meeting of that committee. And I also want to say that I wrote a letter in support of that proposal. And both of these letters, I believe, are public record somewhere on the Opioid Settlement Advisory Committee's website. So if folks are interested, they can look on that webpage and find out more. Let's hear from another member of the public, and then we'll try and move on. Isaac?
There's someone on Zoom.
Oh, okay. Abby?
I am not able to stay on long, but I'm glad I'm able to just participate in this discussion. Abby Manukin, Town Meeting Rep, District 8. I'm actually really aghast that the Select Board is talking about these issues and specifically potentially wanting to support, for example, I think it was referred to as a mental health calming center in Brattleboro, after so specifically and vindictively interfering with the process of each other receiving this grant, this opioid settlement fund money that would not be coming from the town. And Liz McLaughlin specifically almost shut down that proposal herself. She actually intervened. I think that it's really important to name what is going on and not dance around it, because Liz herself was on that committee and didn't want that proposal to even go into the presentation mode. Richard also wrote a letter in opposition to it. And the fact that they're trying to sit there and say there wasn't town collaboration when the list of sponsorships and endorsements from services, including HCRS, which Liz just tried to say was blocking this proposal, is absolutely false and lying. So I think we need to call a spade a spade. There was wide support for this proposal by dozens of support agencies in this town, and Liz wanted to block it.
Thank you.
Thank you.
Say that one of the things that has happened in a previous board meeting here is that people were feeling called out. I think it's fine to have a critique of board's action. It's fine to have a critique of a proposal in the community. It's even fine to have feelings about one another's service. Okay. And I think what's important is that we are as generous to one another as we can be, that we don't, seek to just call each other out in public. I also, I hear people voicing concerns, and I'm trying to balance people reasonably voicing their concerns in a public meeting with people attacking one another. And so I want to name that we should all hold ourselves to a standard where we are not attacking one another, whilst also speaking our minds about topics that we care a lot about. So if we can try and do that, that would be great. Thank you. Elizabeth.
I just want to say that my considered testimony was based on the facts that I knew. I still hold those ideas, and I was not in any way, shape, or form vindictive.
Okay. All right. Other members of the public that would like to speak on this topic of violence prevention as it pertains to the board's legislative agenda? Okay. So let's move on, or should we take a quick 3-minute break? How about that? Because I think we don't need a full 5 or even 10-minute break for this length of meeting. Peter would like a 16.5-minute break. He will not get it. We will take a 3-minute break. Okay, so we have 2 topics left to cover, and the next one is affordable and middle-income housing. And the board has some priorities, including Permanent Act 250 exemption for housing in Brattleboro's designated districts, pre-development funding to spur housing projects, flexible tax increment finance legislation, reimbursing towns carrying a disproportionate amount of affordable housing, housing subsidy program for essential workers relocating to Vermont. And we talked about that back in September, and I'm sure there's been many things going on in the realm of affordable and middle-income housing in the State House, and we look forward to hearing about it.
Okay, so there is good news.
Great.
Other than supported housing and transitional housing, we are making great strides on housing. And Brattleboro in particular is doing a great job on that. And you've probably heard last year was the best year, and there was more housing permitted last year than since 1989. So that's a really notable
in Brattleboro.
Right, in Brattleboro, which is what you're most interested in, I would think.
Certainly in the top 2 or 3. Yes.
You got me there. Okay, so there are lots of things to talk about with housing. I can just generally, what we did in 2023, we changed the regulations for towns in the Home Act, and that's what that act was very similar to what Brattleboro had already done, but not completely. So that made things like duplexes permitted by right. Wherever single-family homes are allowed, now duplexes are allowed throughout the state. It included minimum densities for properties that are on water and sewer. Brattleboro already generally had those densities. So there were lots of things like that, parking, and Brattleboro had done many of those, so you were ahead of the pack. So then in 2024, we did major changes to Act 250, and what those changes were a result of a collaboration between environmentalists and housing developers and business interests. And it was actually pretty fundamental, because it was the first time, I think, in 50 years that folks actually agreed on the general updates that should be made to Act 250. Because Act 250 was seen, and still is seen, as an impediment to housing. Generally, there are many folks who see it as a benefit to the state, making sure that development happens where it's supposed to happen, and with the right supports, like water and sewer, for example. So where we are in that process is that there's a new board. It's called the LURB. It's LURB.
Did you say the LURB?
LURB. I know. It's instead of the Act 250 board. It's the Land Use Regulatory Board, and it's a professional board. I was on the nominating committee, and so that board was started. They went into effect in January, so it's still very new. But what they will do is lots of things, one of which will be very important to Brattleboro, because Brattleboro will develop a plan for the town. You already have a plan for the town. You'll develop a plan in the format that the regional commission wants you to, saying which areas of Brattleboro would be in Tier 1, Tier 2, to Tier 3. So Tier 1 is the area where development should happen. And so that would be areas served by water and sewer, generally, areas that have good zoning and good staff, which is generally your downtown. Tier 3, and Brattleboro will have some Tier 3 areas likely. Those are areas that should be preserved. So the retreat trails, that kind of thing will likely be a Tier 3 area. Tier 2 is everything that's not a Tier 1 or a Tier 3, which is actually how it's defined. So the town will have such a plan. The town's plan will be incorporated into the regional commission's plan. The town can go on its own to get approval for that plan. And the approval goes to the LURB. So once the LURB is constituted, last year they thought they could do it in 2 years, so that they would have that board functional. So we're a year into that process, and hopefully they'll be able to do it within a few months. But I don't think it's holding you back, and we can talk about the details of that. In the meantime, there are interim exemptions, and Brattleboro does, most of the downtown has interim exemptions. There's a little map. I don't know, did anyone see the map? I had a meeting with John a long time ago about this. So within the map, you are generally exempt from Act 250. There's some complications, but it gets complicated. But the combination of the two, of the Home Act and the Act 250 change, is going to be huge for Brattleboro. And then I just want to mention that the other towns near you, they want to and are developing housing too. Putney is, well, they want housing too. And of all income levels. So it was talked about today at the SCVT, that's not the bus meeting, Southeast Vermont
Housing Coalition.
Were you there today?
Other things going on.
I was there
I'm so
for the
sorry, I
first
just
part of it, but
I wasn't trying to call you out.
Yeah, but Putney's very intentional, and they're planning very hard to have more low-income and middle-income housing, and just more housing in general. And they have water, so that's good, so they can do it. Westminster is planning for housing. They want to do more housing. It's more difficult for them because they don't have water and sewer, but they're looking at other options. So like the duplexes, for example, you don't need water and sewer. You can do those with septic. So they have things they can do. Rockingham has already increased their housing development a lot, and they want to do more. And most of theirs is infill, which is great. So housing generally in our area is happening.
Great. You have a question, Liz?
I do. Any of this housing in these other towns low income other than the Putney?
Yeah.
They all are?
No, they're definitely not all.
Yeah.
And we don't, generally you want to have a mix of ranges.
Mm-hmm.
So, yes, but
That's
there
great,
is
Wendy.
that mix.
I just had one question about the 3 tiers and that tier 2 being what isn't 1 or 3.
Mm-hmm.
I wondered, do you think that tier 2 will then be controversial because people will be a tug of war between the 1 and the 3?
I think the 1 and the 3s are going to be controversial, especially the 3s. There's one of the proposals. There's multiple proposals for changing what we did, and one of them is to get rid of the tier 3s. But I can't see that happening.
Thank you.
Okay.
And there's a district that would be something like Putney Road, where it would encourage changes in that type of development.
Well, there's a lot of housing along Putney Road.
Right, but there could be more.
Mm-hmm.
Great. Anything more you'd like to tell us about this topic?
Do you want? I can talk about TIFs. TIFs was on that.
Pre-development funding is also on there.
Yeah, and pre-development funding is available, continues to be available. And actually, let me let you know the Winston Prouty. You had that on the list, so that's going to come to my committee, to the institutions committee. Right now, it's in housing, House Corrections and Institutions, and there are 3 projects that the administration is proposing get $1 million each, and Winston Prouty is one of those. And my understanding is it's for a utility improvements that would allow it to go to its full amount, which is just terrific use. The only issue I've heard is more of a procedural thing, because the capital bill it funds all kinds of things. It funds water and wastewater and parks and historic sites, but it doesn't normally include specific projects in it. And so there is a concern about having specific projects in it. That's a concern in the House. So that bill hasn't come over to us yet, but we have already received testimony from the Commissioner of the Agency of Commerce and Community Development about those 3 projects. There's one other one is in Bennington High, if you're familiar with that. It's a really good project. So they're all really good projects that make sense. So that will be coming over.
Great.
And then TIFs, there are quite a few bills, and some of these.
Wendy?
Oh, sorry. Tax increment financing, and so TIFs are good, I think. So what TIFs do is they let you temporarily suspend providing tax money to whichever taxing authority. In this case, it's the state. And you use that money to pay off development for a whole large area. That's the way we do it now. But then the project-based TIFs are comprised in a smaller geographic area, and generally you want the things that you are funding with a TIF to be government or public things. You don't want to fund something that's a private development with TIF money. The private development is easier to develop because then they don't have to pay for the whatever it is. So it can be water, sewer, sidewalks, roads, but you want the TIF money to go to the government because it's government money and it stays. It won't go away if the project fails or gets sold. So the way that the state does TIFs is just very complicated, and it's a temporary negative to the ed fund is the main issue that I've heard against TIFs is that it has to use education funding.
It's the ed fund?
I'm sorry?
Why?
Because it's property taxes.
Oh, sorry.
I don't hate that. What was you saying?
No.
Oh man. Okay, it's getting late, huh? So there are several bills that are looking at smaller TIFs, and so I think that's a good idea. So we'll see what happens. It's still very early in that realm.
Great, thank you.
You're welcome.
Anything further?
I don't think
No?
so.
Selectboard?
Keep up the good work.
I'm sorry, what?
Keep up the good work.
Oh, thank you.
She mentioned that.
Members of the Select Board.
I'll just make a comment that in thinking about housing, at least in this community, it seems to me the missing ingredient is the financing. I think, our zoning is in excellent shape, and now there's state-level changes in the regulations that are also very helpful. I drive around and I see lots of places I think, we could put a couple of dozen units there, could be well integrated into maybe even create a neighborhood in an area that would benefit greatly from having some housing. But I was at one of our housing group meetings here a couple of months ago, and I think it was Sky Morse who said the problem is you just can't charge enough rent to justify the mortgage that you're going to be facing. So to me, those are the bigger questions, or financial questions, and how do we, I don't even know who we is, but how do we get to a situation where people are motivated to put up money for housing development?
So there is housing development going on that is market housing, like the at TD Bank, those apartments above the bank. That's all market rate and not subsidized. If you're familiar with that.
Oh, I know the building. I don't know about the details.
Well, you know how it's gray now and it has that.
Yeah.
That really funky thing. So that's market. That's at market.
Well, that's good, but there was already a building there. I mean,
right,
some of this we need to start at the ground.
That's even
No, that's what you want. It
is what I want. I just don't think it's going to be enough.
Right, but it's a start, and it's good, and we will see more.
Okay.
There are a few that I know of that I don't know if the developers want me to. Well, it's one on Burge Street, the SD buildings. Those are getting developed, and pretty intense development there. So that's what we want is development within existing buildings, especially historic buildings, and building on vacant lots too that are infill development is what you want, because then the water sewer's there, the amenities are there.
Yep. Liz, you had a question?
I just wanted to comment that I believe our planning director will be scheduled to give us a report on the housing in one of our upcoming meetings.
One of our 12 upcoming meetings. Well, it's a public meeting. All will be welcome. Okay, let's hear from Dick's iPad.
Could go so wrong.
Good evening.
Thank you. Yeah, Dick DeGray, District. I want to push back a little bit on the Winston Prouty housing project and the comments that were made by Senator Harris. I watched that DRB meeting, and it was probably the poorest presentation of a project in the history of me paying attention to projects. We need housing, but the wanton disregard for the way that was presented on the impact of the surrounding neighborhood and things that weren't even taken into account. The legislature needs to make sure that, yes, we need to make some changes, but that the disregard for where these developments are going to go and the impact that they're going to have on surrounding neighborhoods has an impact, and that needs to be taken into consideration. Now, I believe the town gave that project $50,000, and I also I heard when the governor said he had initiated $1 million, and Senator Harris just intimated that that was true. So I'm concerned about that. And then the other comment that I would make, when you were just talking about the TD Bank with our own zoning regulations, is that we always, in the downtown district, there was to be, we had to make a change to get apartments into commercial buildings in the downtown district. That happened in the TD Bank, and it also happened in the buildings that surround the Harmony parking lot, that you are allowed to put an apartment on the ground floor of a commercial space if it abuts the your back door abuts the Harmony parking lot. And I oppose that primarily because commercial space in our downtown district is severely limited. And if you're going to allow apartments on the ground floor, I don't think it's a good outcome for commercial businesses to come to downtown Brattleboro if we're using half of their space for apartments. And I hope somebody would comment on that. Thank you.
Thanks, Dick. I think we did actually speak about this either with Sue Fillion or with you guys last time. It definitely has come up before. Anyone wish to comment?
Well, I'll just say that it's not the state's role to approve development in Brattleboro. That's the DRB and staff. So that's what will happen with Winston
I'm really
Prouty.
speaking specifically to that kind of thing about apartments and commercial properties.
Oh, yeah.
Yeah. The Winston Prouty project that's before DRB, I feel like that's...
So, I mean, what I know, something happens regularly in Brattleboro where folks start talking about housing, and then everyone talks about the old Home Depot, and it sort of goes from there. I'm sure everyone's
we
seen
did that last week.
No. It's significantly more expensive to convert commercial spaces. They're not, the envelope is not designed well for it. And so we have sort of ongoing bills to try to see what it would look like, but in most cases, it's not the best choice in conversion, and often it's better to even just tear down one of those buildings and put up a new building. It's more cost effective. And I just want to take this moment to say Sue Fillion and our planning department are cutting edge across this state. They are a symbol of like the best of what a planning department can be, and have set this town up to do some of the best housing development possible. And I am so grateful to serve a town that is served by such an incredible planning department. And I feel that like regularly in the course of my work in the legislature, as well as in community meetings down here.
That's true.
I was waiting. You always say that, and I was waiting.
It's really, I was just in a meeting earlier today that it was just like another celebration of how great.
But I also think that Dick's question is best answered by Sue, so some other time we should have that discussion.
I agree. Let's hear from members of the public. Okay. Ian, are you desperate to speak right now?
I just wanted to address one thing from Dick very briefly. Okay. May I, Mr. Chair? I just want to say again that there's an instance where there's an administrative and procedural remedy for the DRB, which is that you can appeal decisions by the DRB, which means that if you have a poor decision because it was poorly done, then it wouldn't really survive an appeal. So I don't know if the Winston Prouty DRB decision was appealed or not. I hope it wasn't. But if it has, then I would be curious to see where it's gone.
Yep. All right. Frank?
Rick Sprite, District 9 Rep. First of all, I'd like to thank Dick DeGray for bringing up the issue of what I would describe as balance between commercial, industrial, and residential space. I have an ongoing question about why we need so much more housing. I'm not saying we don't, but the math is mysterious to me since we have been building housing all of my many decades here in Brattleboro, and our population has not gone up significantly. I think I understand what part of the
Richard?
The answer is, and it has to do with something we talked about earlier, which is concerns about victims of harassment and crime, and there seems to be sort of an unequal concern about victims. If you live in a multi-unit building and you're a victim of harassment or abuse, it's basically tough luck. And for those of us who are responsible for taking care of people in multi-unit buildings, as a housing provider, I don't feel like I have a lot of support to take care of problems. And one of the tools that has been discussed that I understand some are lobbyists at the State House have said they would go to war over is the ability to no trespass people who are making life miserable for others and effectively depriving them of the right of quiet enjoyment of their apartment, which is supposedly guaranteed under the law. So that is, I know it's a tough political challenge, but I would urge all of you to consider how to address that. I have a couple of quick questions. One is, how do I get back on the distribution list for the Housing Coalition meetings? I am not seeing anything in my email.
Email Sue Graff.
Okay, I have been on it. I've requested it, and
I'm not the keeper of the list.
Okay. And I have a quick question about how to
about 30 seconds left.
What would get a property on the third tier, and as an owner of some rural property, am I in danger of being tier 3'd?
Is that the end of your
I don't know.
questions? Yes.
I mean, possibly. I don't know the property.
Okay.
Great.
So I should be concerned about that.
I think I'm going to give you the award for managing to weave together multiple strands of these priorities into your question. So you were talking really about violence and housing and poverty, I think, and maybe even substance use. And I think Ian Goodnow, Esquire, has something to say on that matter.
Yeah, do you want me to address?
Sure, why not?
Yeah, so what Frick was...
You should probably move the microphone.
What Frick was referring to was I sort of there were individuals from the community reached out to me around this issue of no trespassing non-tenants from multi-unit housing in Brattleboro and in Vermont, and the difficulties that currently exist with the existing law to be able to do that. And yet again, the hammer, everything looks like a nail. I sort of thought, well, we get some statutory remedy here pretty quick. And I was really wrong. I was so wrong. But it has sort of, it got me talking with all of the parties that are involved in this, from tenant rights attorneys to housing providers in our community, private landlords. And what I'd like to do is try to, instead of trying to kind of get something pushed through quickly that's not right, that's not the right resolution or right fix for this issue, is to take some time in the coming months to sit down with all of those individuals to see whether this is actually something that needs to be changed within the existing law, or if, again, this is something where how it's being implemented could be done better. So I think that's hopefully that addresses what Frick was referring to. And it was definitely a good learning lesson as a freshman legislator.
Mm-hmm. Thank you for the work.
May I just ask just a clarifying question with regards to like no trespass in a multi-unit dwelling. It's my understanding that if there's a non-resident that is presenting as a nuisance, that the entire building has to no trespass. Am I understanding that correctly? So if there are 25 units, 25 people have to basically say we don't want that person in. Is that
so? That
if it's an oversimplification, tell me.
It's not. No, and Peter, it's not an oversimplification. And what's wild to me is that I have spent a while trying to understand if that's exactly true or not. And it kind of is and it kind of isn't, because it has to do with the common spaces. So someone who no trespass an individual from your own unit, you don't need to have every other person within the multi-unit sign a no trespass. That no trespass is effective. To get someone no trespass from a common area, all of the tenants have access to the common area, and that's where you get the situation that you're describing. But that's kind of a simplified sort of understanding.
Well,
but
it's extremely nuanced.
Yeah, and I think that it's another area where we are balancing two really important issues. A tenant who has signed a lease agreement, that apartment is their home, right? And they have a right to that space, and so they have a right to. They have a right to
keep it overhead.
They have a right to invite who they want there, right? So we can't. So there's that protection that needs to be maintained. But then on the other side, what Frick was talking about is everyone else who lives in a multi-unit has a right to be able to live in their space and feel safe and not be disrupted. So there's that balancing act. And I can't really sit here right now and tell you that I know what the solution is, but at least we're looking at it.
Yeah, working on it. Thank you.
Okay.
I think we were in public questions. Amanda.
Amanda Ellis Thurber, District 7. Thank you for coming. I had a question for Senator Harrison. Act 250 legislation last year. This is totally different from. This is about farms. There was a loophole that happened for farm businesses that had markets or farm structures that are not exempt from Act 250 or the lube. And instead are still but are still under the jurisdiction of the same Act 250 permitting that occurred before. Right? Is that correct or incorrect?
Well,
so I'm talking about. Yeah. So say you're at Wild Carrot Farm, and you go into their farm store, and they want to do an add-on. That's subject to Act 250 permitting as it's written now, or Lilac Ridge, but I just picked it.
Right.
So
I can't tell you right now exactly what happened, but I'm happy to look into it. I'm not on that committee anymore, but I know we made we tried to make it easier for on-farm stores, basically. That was the intent.
Thanks, Wendy.
Okay.
Yeah, appreciate that. Any other questions from members of the public on this topic of affordable and middle-income housing? Yep, Cassandra.
I just have a quick question. Is there anything around single-room occupancy for, like, I'm just thinking especially of our younger generation or our refugee population or just people who are middle-class-ish but not quite, those people on the edge, usually in social services, for example, or just temporary house. I'm just wondering if there's anything around that, because I think just having a room is something. And I think also with isolation,
that wasn't in our bill, but
that's not part of the legislation. It's not. There's no legislation sort of necessary for that. But I know that a lot of housing providers in Wyndham and Windsor County are working on that.
Great, thank you.
And we already have a decent amount of single room occupancy housing in the area. It tends to. It's harder to fill.
Okay. Let's move on. Municipal revenue enhancement. Mysterious topic.
That is me.
So the board had some priorities, including lower VTrans costs for regional roadways. Done. Increased local option tax distribution from 70/30 to 95/5. Surcharge for hosting state-funded social service organizations. Reduce exempt properties, state, county, nonprofit, or compensate towns with a disproportionate amount of them. Reduce tax sale delay period from 2 back to 1 year, or provide state funding to underwrite the new mandate. And F, allow a town to add municipal charges to a tax bill for collection purposes through tax sale.
Wendy, you're on the VTrans cost for regional roadways.
I'm not exactly sure what you mean by that. But actually, let me tell you some not bad news. As far as federal government funding goes, the transportation funding gets allocated in 6-year tranches, and so we still have 2 years coming. So except for things that support electric vehicles, we still have that money, and we should be okay. The unfortunate situation is not because of the federal government, but just because of the how prices have increased so much with inflation, and so we're getting a lot less. The town is too. You get a lot less for your money in building roads.
Mm-hmm. Do you want us to explain about the issue we had with?
I certainly do. Thank you, Daniel.
Liz would like to explain.
So, we had the case where, what's the number of that bridge?
Bridge 54.
Bridge 54 is actually a local bridge for some obscure reason, because there's 17,000 cars a day that travel from New York.
Is that the one on Western Ave?
Yes.
Yeah.
Okay.
On Route 9, right? That really old bridge.
17,000 people travel a day on that road between New York and New Hampshire. However, it is a local road, and then subject to a 10% match.
Right.
Our VTrans, we as a board said, we're not doing that, because the costs went from $500,000 to $1.5 million, and we said no, because the cost to design when we first said yes rendered that $500,000. Then they went up 3 times the cost, and we were at the mercy of this 10% match until we said no, please look at it again, and VTrans did exactly that with the help of Senator Welch's office to find federal funding. But, so that was a good ending for us, but still, VTrans 10% match without putting any sort of a cap on the spending is highway robbery for every municipality in Vermont. And that just came to me. But still,
Highway robbery.
the match.
Now I get it. Okay.
We're all there.
The match is outrageous.
Yeah,
Because, you know,
So I know that Molly Burke is very much on this because she went through the Bridge 54, is that what it's called?
Yeah.
She went through the Bridge 54 journey with you in depth,
Yeah.
and I know she is working on this, and I'm sorry she's not here today. I can ask her to send a follow-up.
Right.
But the
she
point
was
I want to
integral in
make
this.
is that match is not fair for municipalities across the state. And something has to be done with the escalating costs because, you know, VTrans gets federal money. And in this instance, we were saved by federal money. That's not going to happen everywhere.
Right.
And it's not going to happen again to us. And something needs to be done because people feel that they have to say yes. But in fact, look at what we gained by saying
Right.
no.
No, and good for Brattleboro. Yep. That 10% is a federal standard on different things. Different things have different standards.
Okay. So let's hit some of these other topics.
So this is one of my favorite ones because here's a really fun fact about local option taxes. When they are distributed in the 70-30, that 30% that stays with the state, anything in excess of the administrative costs, and administering a local option tax at the state level is actually incredibly complex for a variety of reasons that are very boring. All of that other money goes into the pilot fund, which is another one of these items that you want to be more fully funded. And so this is the first year that pilot payments have been fully funded. Usually there's not enough money in the fund, and so the amount that goes to each municipality is reduced. But this year, thanks to folks spending more money and actually an expansion of the number of local option tax towns, there is enough money in the fund to fully fund the pilot payments. And everyone saw that there was a lot of money in the fund, and they said, change the ratio, because we shouldn't have too much money in the fund. And so we are planning on moving out of the Ways and Means Committee, a change in the split in the local option tax distribution, but not to 95-5, because then we wouldn't have any money for pilot funds, and pilot funds are really important to municipalities. So likely, if we put it at 75-25, we can return more money to municipalities and fully fund the pilot fund. And while that is not perfect, it is slightly more delightful than now. On the other items on the list.
Let's talk about that before you go ahead.
Okay.
If you don't mind.
I guess I don't.
A member of the public reached out to me to discuss an idea regarding the unfunded mandate associated with hosting the motel program in our town.
Did we just drift way off from
No.
local option funding?
No, I will just hold your horses there.
Okay.
And he suggested that the specific 6 towns that are overburdened by being host municipalities, they should receive an exemption to have 100% of their 1%. And then we would get some measure of compensation for the unfunded mandate because, as you know, we expend, and I think John Potter has calculated, $1.5 million in variety of municipal services in our hosting of the people in the motel program. And if we were to do this plan that was suggested, these 5 towns would get 100%, but still the pilot would remain for all the other towns.
That's a fun idea. I think what would happen if that was put on the table as a proposal is then folks would say, okay, those 6 towns get 100% because of this, and I think the towns who were just flood impacted should get 97.3% because of this, and these 5 other towns that host major federal dams should get 98.7% because of this, and there would be no more money in the pilot fund to pay towns for the pilot. However, I do think it's very important that municipalities have more flexible funds and revenue for a wide variety of reasons. I think if we could think differently about the local option tax and the pilot fund, which is sort of a discrete package that is mostly will be sort of self-managing very soon with that change, and move into a conversation about what it would mean to have more revenue going to municipalities on some sort of rating system like what Massachusetts has or what Minnesota has. I think that might be a more comprehensive way we can tackle this. And the proportion of poverty or social services that are hosted in that community could be part of that rating system, along with a number of other things like, say, climate risk. And we began work on that last biennium. There's a working group that the Treasurer's Office is hosting to continue work on it, and we will continue from there, but it's going to be a little bit of a slog to get there.
The last time we spoke about this, you mentioned that you would send us some material, and it got lost along the way. Could you do it right now so that doesn't happen?
I will indeed.
Also, could you let us know when that group is meeting and whether or not any testimony would be appropriate?
I will do my best on that one. That might be a good thing to ask the treasurer about on Saturday.
Oh, yeah. We know that.
If you can catch him for that.
Okay. Where were we?
I think there's some more items on the list.
Yeah. Can we,
No. I want to say something about this and about these pilot funds.
Okay.
I don't think your explanation really holds water, that you're taking money away from us in order to redistribute it to municipalities in general. Well, that's our money. That comes from our having enacted the 1% tax. And to say, well, now we won't have enough money for pilot funds without it, maybe you should find a different source for pilot funds, because this money is coming from the towns and going back to the towns. You're just taking it out of one pocket and putting it in a different pocket, and you're taking it out of our big pocket and putting it in our little pocket. And I don't think that's fair to us. So I don't think that is a good justification for why you need to collect 25% of this money. I think you should collect if there's expenses involved, fine, make up your expenses, but the rest of that money should come to us. That's what I think.
Okay.
I can talk more about the philosophy behind the local option tax if that's helpful.
Sure.
So when local option tax first became enacted, which was before my time, there's a tremendous amount of discomfort about them because we do our best to make our taxes as equitable as possible in Vermont. And some communities had a much greater ability to collect revenue from a local option tax than some other communities. And that is still sort of tax capacity of Vermonters, right? And so if that's being collected just for one municipality and not for the state as a whole, there's a real concern that inequities statewide would result from that. And, South Burlington is a great example for sort of the scale of money they can collect from local option tax. Because any tax you collect is sort of reducing from the amount of tax you can collect somewhere else from that same individual who's paying those taxes. So that is why when sort of the bargain was struck in order to allow local option taxes, the idea was that some of it should be redistributed because there's sort of an essential unfairness in the economic capacity from town to town to do that. I would ask you, sort of the next step, which I don't think we'd be able to answer today, is where do you think that money should come from?
For the pilot program?
Sure.
That I don't know. But, I've never even considered that question until now. But I think Liz's proposal has real bearing on this. You say, well, that leads to inequities in tax collection. Well, how about the inequities and the burdens imposed by state policy on municipalities? We are unfairly assuming burdens that other, towns, presumably with less of a retail tax collection ability, are having to pay. So, I'll go along with Liz's proposal just fine. And, if there's a flood, well, we can blame nature for that. But what I'm saying is that there are costs on this town that were imposed by the state. And that's a different category of expense from facing natural disasters or something else. I'd like to vote in favor of taking billionaires' money and devoting it to the things that the people really need. But short of that, I think there's some fairness issues here as well.
Mm-hmm. Thank you. Okay. I mean, I think that the big question that's floating around here is, how can Brattleboro be compensated for the impacts of, state programs that I get really kind of antsy around this conversation because I feel like it's sometimes characterizing the motel program as a bad thing, when if we had fewer options for emergency housing in our communities, it would be a much, much worse thing. And so, there are certainly bad things that have occurred in the motel program. It is not a perfect program in any way. There was a piece in the Reformer, I think, this morning that was pretty interesting about it. And also, I don't want to kind of paint that program with too kind of simplistic a brush that says this is a bad thing. What we do know is that at the motels that have been, operating in that program, we've had a higher number of emergency calls, and that is burdensome to the town. And so I think we're advocating really for some kind of redress to that excessive burden.
I think what is hard about the framing that you're addressing is that the motel program not being there would actually cost the town more because people sleeping in a tent by the river or in the streets is a much higher public burden than folks having a private place to sleep at night. And I absolutely think that we need to find many more ways for municipalities to have way more revenue than they have right now. We have a wild system here where towns are carrying more and more of the burden of the state not being able to meet its obligations and not having the revenue to do that.
Yeah, Liz?
Yeah, it's an interesting thing because everything that we've talked about tonight would be a fix for the motel program. We need more treatment beds. We need more mental health beds. We need more housing for families and for disabled and for just people in general who are handicapped, and we need sober. We talked about all that tonight, sober living and everything else. And so the problem with the motel program is that it can't be a binary system. It can't be yes or no, because the no, as Emily just said, are the streets of Brattleboro. So all of those elements have to go into what would be a proper alternative. And I don't see that happening at the legislature. But please tell me if it is. All those alternative housing means need to be enacted before June, right?
I think we've spent the bulk of the meeting talking about how we are actually making progress to offer resources for all of those things, and there is significant building happening all over the region. And there's also significant legislative changes being contemplated to the motel program to try to make it slightly more sustainable than it is now. But these are, we talked about basic constitutional rights. These are the great challenges of our society right now. We tried to do a lot more last biennium to more fully fund housing. That did not happen, and we are in a more difficult position now than we were last year to really have the revenue that we need to meet the needs of our communities. But we're going to keep on trying.
Mm-hmm.
Appreciate that.
Yeah. Thank you. Okay. Anything more we want to say about municipal revenue enhancement, or should we hear from the public? Wendy?
Just want to say stormwater utilities, I've said it many times, I'm going to say it again, and if they're actually going to be better, if there's certain legislation that is going through now that would change the 3-acre rule for our area, so it would make it easier to establish a stormwater utility. So diversifying your revenue stream would be helpful.
Great. And I know that Liz won't forget about it. I know that John won't forget about it in DPW.
No. Yeah.
And I'm sure you'll let us
I'll
know
remind you again.
when.
Patrick's going to get that done by the 24th, right?
Patrick's got it on his plate. He's working on it.
Stormwater utility?
One of his projects.
I just wanted to talk about.
Yeah, let's hear from Richard.
Listening to this discussion, what I'm thinking is that the burden of a responsibility for a state or a municipality is something that never is defined. It sort of works itself out. I mean, in a lot of cases, we never know if we're better off just supporting things on our own or whether we need the funding from the state. I mean, I think there's a lot of gray areas there that legislation can't resolve and that the state can't resolve, and that sometimes maybe a municipality has to just do what they can. And, it's sort of a vague idea I'm throwing out, but it just seems very frustrating to not have a town have the ability to support the kind of programs it wants when it asks for state help. And but it's nothing anybody seems to have any control over in the short run and the long run.
I mean, I think being a Dillon's Rule state is a really complicated thing, and especially in a state with so few people living in it, where most municipal government consists of a couple of volunteers. Most of the power does need to reside with the state, but that's really, really challenging in places like this.
Mm-hmm. Thank you.
I just wanted to mention number E, reduced tax sale delay, has caused a lot of problems in our town. I'm sure you're aware.
There was a working group. So the bill to standardize tax sales throughout the state had a working group in it to resolve some issues. The working group had recommendations that they came back with. The working group had like the Bankers Association, the League of Cities and Towns, and lots of different stakeholders. Their recommendations are going to be incorporated into a very large bill that's going to move out of the House in early April. It is exempt from crossover deadlines. And because it's the education policy reform bill, but because that's sort of changes to property taxes, it's going to be included in that.
Okay.
So it's going to be fixed?
Yes, many things will be fixed in it. It's still a month out, so I'm not entirely sure.
Because not only did we have a deficit, but it gives people, kind of more time to get in trouble.
I understand that.
Thank you. Let's hear from the public.
Can I just one more sentence?
Yeah, sure.
There were some communities that were going to tax sale for like a couple $100s. It's not okay. Mm-hmm. And I understand that that wasn't happening here, but so thanks for your patience as we tried to fix that.
Let's hear from Fidel, who I think is David Levenbach.
Thank you very much. David Levenbach, District 9. Brattleboro is burdened with being a hub town, and people have talked about this concept of hub towns and common interests that hub towns have. Is there any prospect that something might happen to designate hub towns and provide additional resources for them? And if there are any prospects for that, how do we move that forward? Thank you.
David.
So we are very slowly working on this. Like, it's really like a very brand new idea around municipal revenue sharing, right? Not how the state has generally done business. And so it's going to take a while. We're working on that. And my understanding is John has joined with some other hubtown mayors, managers, et cetera, at VLCT, which, because it represents all communities in Vermont, can sometimes not represent hub towns as effectively as it might. That's the Vermont League of Cities and Towns.
Mm-hmm. Great. Working on it. Christina.
Christina Shiania, District 8. I had a similar question, but not about the hubtown thing, but about the being home to the largest psychiatric hospital in the state. But is it like that thing where it's like, well, we're the home to this, and then every other town has its own reason why they should get more Or is the concept, because I know the retreat's been around for a really long time, the motel program has too, but not in the capacity that COVID brought with it. But yeah, so is there that concept of being home to the largest psychiatric hospital in the state and more money coming here for services, for transition services? Does that exist at the state level?
Thanks.
So I believe the retreat pays a payment in lieu of taxes, and it is the largest employer in the region fairly regularly when you look at the statistics related to that. So there are certainly impacts of it. There are also a lot of benefits to having the retreat here, and I think historically those have been sort of considered to balance each other out. With lots of work in the middle of that. When we get far enough along on this municipal revenue bill, I think the hardest piece will be to figure out sort of what the rating system is and what causes a community to be sort of like weighted for more revenue or less. And that could certainly be considered in that, though, yes, likely every community will be able to name something like that because.
Mm-hmm.
Yeah.
Thank you. Other questions or thoughts that we'd like to share before we wrap up? Okay. Seeing one. Go ahead. Seeing two.
I would like to thank you for coming and for your hard work and for the recognition that, our townspeople are your people and we're working together for the betterment of the town.
Thank you.
Yeah, I'm kind of jumping on board with that. I think this was a really valuable session. I heard a lot of things that were educational or reinforced various things, and I'm glad these sessions are taking place. I think it's a really excellent innovation in town affairs in recent years, and I look forward to all of you continuing.
Same.
Thank you.
Thanks so much.
Thank you.
So we have one more thing to do here, and we need a motion for it. Liz?
I move to adjourn.
Okay, Liz has made a motion to adjourn. All those in favor, please raise your hand and say aye.
Aye.
Aye. Passes 5-0, 6-0. Now.